Okay, here we go. Welcome, Dr. Trubow, to the Fast to Heal Stories podcast. We are so excited to have you here and to pick your brain over the next hour or so about chemical toxins and how they might relate to our health and weight loss resistance and all of those things that people don't always think about. So we are very excited and honored to have you here. So
It's
welcome.
really my pleasure. It's so great. I'm psyched because there's totally a tie, right? We're going to untangle it, but it's tied
Yeah.
up.
Yeah. So let's start with how you got to where you got so involved with your book, Dirty Girl, and how you got so invested in this toxin realm and environmental toxins. And then from there, we'll kind of jump into those obesogens because I know for my audience, a lot of them struggle with weight loss resistance and they don't understand how that can all be tied in. So I want to make sure we cover that. But first, give us your background and how you got so interested in this topic.
Sure. I mean, someone said to me once, did your mess become your message? And I was like, totally. So I got exposed to functional medicine when I was 35 and then went into functional medicine when I was 38. And so I was aware of toxins. I tested people for toxins, but then I had my own personalized health crisis essentially when I was 48. And I really hit the skids. So I went on this amazing vacation. We went to France and we went with all of our kids. I have 4 kids. We went with all the kids, both of our mother-in-laws, like my mom and my husband's mom and my husband. So there were 8 of us on the trip. And I came home from the trip and I gained almost 10 pounds and had this killer rash on my face that would not quit no matter like what I did. It was itchy and it was on my eyelids and under my nose and in the crease of my chin. And I lost like half the hair in my head and I was freaking out. I'm like, what's going on here? So what does any human think when they gain weight? My thyroid's off. So I could test myself. So I test myself. My thyroid looks fantastic. Okay, that's great, right? But that's not going to help me figure out what's going on. So then I was like, okay, I'm 48. So maybe it's my hormones. So I test my hormones. My hormones look fantastic. All right, Shanna, now I'm like irked. And I'm like, okay, well, the gut runs the body. So let's check my gut because I have celiac disease. Maybe it's that. I check my stool and it's like, I mean, it's poop. So it's not like woohoo, but I was like, oh, it looks pretty darn good, especially for someone with my profile. Okay, so it's not this or that. And then I'm kind of stumped. I'm like, what's going on here? And I hear this report on the radio that when Notre Dame burned, it released 500 tons of lead dust into the air. And the closer you were to Notre Dame, the higher the lead exposure you got. And then, of course, it kind of decreases the farther you get away from Notre Dame. Well, I was in Paris the week after Notre Dame burned, and that was that amazing trip of a lifetime I took. And I looked at my husband like, oh my God, I think I got a lead. We all got a lead exposure, but I'm sick. So I tested my lead and it was significantly higher than it had been in the past. And I started treatment. And I also started treating mycotoxins, which I had done the test right before we went to France, and I got it back. And mycotoxins are these toxins that mold puts out when you've been exposed and it's hanging out in you. Creepy, awful. So I had 5 strains of those. I had mercury, I had lead. And then I'm like, well, in for a penny, in for a pound, I'll check all my toxins. So I checked this really extensive 17-page report that looks at gasoline and plastics and formaldehyde and flame retardant and styrene and VOCs and you name it. And I tested it. And I was sky high for a ton of them. And I was like, I looked at my husband again and I was like, I'm such a dirty girl. And then I was like, and we're going to write that book because we consider ourselves to be the poster children for healthy living. We walk the talk. Like, we do functional medicine and we do it, right? Like, I take a bunch of supplements and I don't eat gluten or dairy or sugar. And like, I live it, right? And yet I have all these toxins. So my mess became my message because all of us are essentially getting drowned under this waterfall that we're being exposed to. And it's underneath every chronic autoimmune disease, chronic disease, metabolic disease, like really anything you can throw at me, my response will be, well, sure, you need to make sure that the system is functioning, and then you need to make sure there's no toxins, or at least that you get the toxin burden lower so that the body can deal, right? Because we're all getting, throughout our days, no matter how good we are, how much we try, we're getting deluged, and it's having a clinical effect.
That's an interesting story because not many people have that such sudden reaction like you have. It's just this thing that just builds up and little symptoms start to pop up. Like maybe you have a little bit of a skin rash or you gain a couple of pounds but for you, it was like, bam, here it
Boom,
is.
right?
My skin's a mess. My hair, I mean, any woman, hair falling, losing half their hair, that is enough to like set
It
you
got my attention. It
on
totally got my attention. Yeah, I was like,
yeah.
oh, no.
It's like we can outwardly see that. But yeah, how scary. What a scary experience. But at least you
Yeah,
had the knowledge and like the body's just not going to turn on itself like that in
right.
just a couple of days time. And those who listen to my podcast know that my son has a similar story in that he's like well one day, sick the next day, and then stayed sick for years. I'm like, okay, that is strange. Like there's got to be something. There's got to be a culprit. And the fact that with mycotoxins and lead, like you can't see it. So it's just
Right.
scary thing. So I'm glad that you figured it out. And yeah, like you said, from pain to purpose, and toxins can play a huge role with people. And I know in my courses, that's like the very first step I take with people. It's like, okay, let's get your body ready to actually heal. And a lot of that is cleaning up, cleaning things up that you more food related, but there's so much more. So let's talk about so we talked a little bit about mycotoxins and the mold that you were exposed to, but can we talk about that topic of obesogens and tell listeners what that is? Because I know you and I kind of throw these words around like, oh yeah, just like decrease your level of obesogens. And I don't even remember how many years ago it was that became an official word. Like I don't know, when I first started talking about it, my husband just looked at me like I was a complete lunatic, but it's a real thing. And
It's a thing.
tell us about obesogens and how they can get in the way of weight loss and healing.
Totally. I just want to say, I'm going to use that word a little bit differently because my experience with toxins is so broad and the impact is so massive. So there are specific things that are linked to obesity, but when you take a step back and you say, okay, what's causing obesity? Well, systemic imbalance, I would say, is the thing that sets the body off. Something's wrong and the system gets cued in the wrong way. And excuse me, the body only has a couple of responses, right? So we can lose weight or we can gain weight or we can stay the same weight. There's only 3 responses we can have around weight. And then, but when you look at obesogens to me are anything that are throwing the system off and causing the body to go down the pathway of gaining. Now, when you take even a bigger step back, anytime you're exposed to a toxin, it goes through a process to get it out, meaning it comes into your body, or you breathe it, you eat it, you step on it and you absorb it, or get it through your hands. You get it into your body in some way, and your liver is responsible for doing the majority of your detox work. Your skin does some, your kidneys do some, but your liver is really the thing at cause. And so your liver sees this toxin. And now, by the way, hormones can be toxic. Alcohol is toxic. Foods can be toxic. It's not, don't think of it just like, oh, I did my nails or I sniffed or I huffed, right? It's not quite that simple. The bed you sleep on could be toxic. So you get exposed to all of these toxins throughout the day, and your liver is the first one to be like, hey, I recognize you. And your liver is responsible for doing the broad majority of taking a fat soluble toxic ingredient, whatever that is, and converting it into a water soluble ingredient that can be excreted. So you can't, it's very hard to excrete fat soluble. It's very easy to store fat soluble. And any of the listeners listening are going to be like, oh, I store it in my fat. Fat goes to fat, water goes to water. So The liver is responsible for converting it. And in the middle of converting it, typically from the fat soluble to the water soluble, it makes it a toxic intermediate. So now it's even more toxic than it started. Go figure why the body does that. I don't know. So there's a lot of places this can go wrong, right? And so obesogens are substances that you're getting exposed to at levels that you can't process, whatever they are. So that's why I'm saying it could be a food, it could be a hormone, it could be the flame retardants in your bed. There's a lot of things it could be, but your body's not able to deal with the toxic load. So now the body's smarter than we are. The body's like, well, I can't get rid of it. I'm going to store it in the fat. And now we talk about obesogens because they are difficult to get rid of. And because of that, we store them because in our bloodstream, they're very toxic. You want them not in the bloodstream. So you either have to get it out of your body or put it in storage, which is your fat. So these are anything that you're exposed to can act as an obesogen. People typically think of them as, the PFAS and the endocrine disrupting hormones and BPA, but really it can be anything. If you have a major toxic exposure, you're going to start to gain weight. Mycotoxins can do it. Metals can do it. It's really pervasive for the number of toxins we're exposed to.
Yeah, and we're exposed to so many more toxins at this
Yes.
day and age than ever before. People just don't think about that. And I tell people that all the time, like the body fat is the safest place for your body to put a lot of these toxins that you're exposed to. So in your experience, when people are trying to lose weight, and I see this all the time too. It's like, oh, I followed your program or I followed your suggestions for 3 months and nothing. And all of a sudden, like, ooh, I saw 2 pounds of weight loss, and it's not all about weight loss, but I saw 2 pounds of weight loss in 3 months. And then all of a sudden, the next 3 months, it was like 20 pounds. So in your experience, do you see when people are working at weight loss, do you see like the body just kind of holding on to that body fat when people are trying to lose weight? And then going along with that, are there some things that we can do to help the body along with that process? Because like you said, the body is smarter than us. It doesn't want to unleash all of those toxins when we're trying to lose weight, and people can get really frustrated with that.
Yeah, so there's a lot in that, Shanna. So let's just assume that the listeners are doing everything right. And what I mean by that is they're eating in a way that their body likes. They're minimizing sugar, minimizing processed food, minimizing seed oils, moving their bodies. Those are the basics, right? You got to move enough and eat the right types of food for your body. But then even so, there are a lot of people who won't lose weight doing everything right. So let's talk to the people who do everything right and don't lose weight. So the first thing that I always look at, and actually we have a program also, it's an 8-week program. We call it Feel Freaking Amazing. And it's like, you can't expect to detoxify if you're not sleeping. So we're really we spend time looking at what are the foundations of your life. I personally believe that stress is the nastiest actor for weight loss and for balance and detox because it's pervasive. We can't get away from it, and it's throughout our days, and it's just unremitting. So we're looking at the foundational things. Are you moving your body? Are you sleeping? To sort of go off on that one, 7 hours in bed is not enough sleep because you don't have 100% efficiency of the time you're in bed. So 7 hours in bed is like 6.25 to 6.5 hours of sleep. And then of that, maybe you're getting an hour of deep and 2 hours of REM and 3 hours of light. It's not enough. So you need at least 8 hours in bed, if not more. I actually learned in COVID that I need 9 hours in bed. That's where my happy point is. I literally never would have acknowledged that. I would be like, no, I'm fine on 7. I wasn't fine, but I didn't know, right? So it's really important for people who are looking to lose weight that you have to address the foundations. You have to sleep, you have to de-stress, you have to avoid sugar and alcohol, avoid processed foods, avoid the seed oils. And then think of it like you're starting to ramp up the detox mechanism. It's at a dead stop, or at least it's just keeping up with what you've got, but you want to ramp it up to deal with what's in your body. So you've overloaded the system. So now we need to improve your ability to move toxins. So exercise does that because you sweat out toxins. So that's great. Saunas, Epsom salt baths, anything that helps with stress reduction and detox. And then there's a lot of things people can do. Now, no, there isn't one size fits all. So don't listen to this and be like, oh, I have to do everything. No, these are just sort of guide things. So it's always important to support the liver's function. The liver loves N-acetylcysteine and alpha lipoic acid. Those are precursors for glutathione, which is one pathway that detoxification goes down. It's one of the 6 pathways that happens in the liver. One of them is glucuronidation, and you need liposome. I'm sorry, you need glutathione. So ensuring that you have the substrate to go down the proper pathways, these support the liver. The liver loves minerals and nutrients, the B vitamins. The liver loves glycine. The liver loves niacin. That's another B vitamin. There's a lot of things that the liver loves. As a note, niacin, if you take it, it can make you flush. So do it with a physician. Don't just do it. And so there's a lot of things that people can do, but you want to think of it like, how do you pull off what I'm getting exposed to, optimize the system, and then start removing what I'm holding on to, right? Because if you continue filling up the body with toxins, you know, or if you're a stress ball, all the detox work in the world isn't really going to work. You need to optimize the platform and the foundation for it.
Sure. Yeah, there's a lot that goes into it. It's not like,
Yes.
oh, I'm just gonna like start dumping these toxins, and yeah, the intricacies and the foundations all need to be in place. And stress is just a funny thing. It wreaks so much havoc on the body and the system as a whole. And I'm glad that you mentioned the foundations of sleep. We talk about that a lot on the podcast, and I think, you know, a lot of my listeners are perimenopausal, menopausal women, and just that in and of itself, like getting that very well managed and under control is often step number 1, like you said. So very, very interesting. So I'm glad that you brought up the topic of seed oils, because I think seed oils are one of those things, and a really hot topic that's just starting to come to light.
Yeah.
Like even a couple of years ago, I didn't really focus on, well, probably about 5 years ago, but last 5 years or so, I've focused a lot on seed oils with my students and those who work with me. But it's one of those things, like you pop that word seed oil or that term, and people just kind of look at you blankly, like, what are those and
Right.
why are they harmful? And I just had somebody send me a message, like a direct message on Instagram a couple of days ago. And not to, you know, we're not here to start bashing industries, but it was an article written by a registered dietitian promoting and condoning using canola oil, and you need more polyunsaturated fatty acids. And it's so hard when there's so much misinformation out there. But would you, let's talk about seed oils a little bit. Like, would you consider those an actual toxin, or what are your thoughts on that, like those, and where they're stored? And, you know, do you have much, you know, the research behind that, and what that looks like in the body?
Yeah, I can't quote a lot of data at you. I don't have a lot of data to quote, but what I'm thinking about is that essentially they're, for a lot of bodies, they're very inflammatory. So, you know, you're going along, you're trying to do your work, and then you have to deal with something that's stressing the system. If it were only the seed oils, it probably wouldn't be a big deal. But it's not only the seed oils, it's the seed oils with your crazy job and having to get your kids someplace and not sleeping enough, or maybe you're perimenopausal, so you're not sleeping. And that's another stressor, by the way. Maybe it's you're not eating food that is optimal for your system. And so some people are fine with seed oils. They're totally fine. But I think people fall into 2 categories. Either you're strong like a bull, where nothing phases you. You could stay up all night, you're nice and fresh, your brain works. Or then you're like me and you're strong like a mouse, where you're thrown off by things that come at you. I do not process things well, right? Like I just don't deal with them well. If you're like me, you're not going to tolerate the seed oils as much because they're stressful and they act as an inflammatory agent. So you can't deal with it as well because you have all these other toxins to deal with. You couldn't even deal with those. And now you're adding another thing. So it acts as like it would have been okay if it were alone, but it's never alone.
Right.
That's what we run into.
Yeah, and that's a great way to put it, I think, because if we're taking in a lot of seed oils, we're taking in a lot of processed foods, which have
Yeah.
all kinds of other chemicals
Right.
and other additives, preservatives, whatever is in that processed food, or you're taking in a lot of restaurant foods or fast foods, and
Yeah.
again, exposed to a lot. But I just thought I'd ask, if you knew exactly how those were processed, and I know, from what I've understand, they are they can stay like hang out in the body for a long time and be hard to detoxify in large amounts. But I think you're right on. Like my husband's one of those people. It's like he was born with such a huge bucket to be
Hmm.
able to
Hmm.
like accumulate and detoxify toxins. It's like nothing really phases his body.
Yep.
And I'm kind of like you. I'm like, I have to be careful, and I'm very healthy, but if I went off the rails, I think I would derail pretty quickly.
Right. We have itty bitty buckets. He has a massive bucket. We have like a tiny bucket.
Yeah, so hopefully my kids get more of those massive buckets.
Yes.
So what are some of these toxins that we should be I mean, they're everywhere, but can
Yeah.
are there some that are like kind of really high on the list where you say, okay, like if you are an unhealthy individual, you have autoimmune issues, you are weight loss resistant, you're just kind of a metabolic mess, or you're just a health mess, like where do we even start? Like, are there some that you're like, absolutely, you need to start here and get this out of your system, out of your environment?
Yeah, this is a great question, Shanna. So let me start with, in order to really, so there's the detoxification that occurs when you address the foundational behaviors of life. You eat food that's organic, minimally processed, and low sugar with low to no alcohol. There's pooping every day to move the toxins out, sleeping, moving your body, having relationships that are healthy, managing your environment so that it's healthy. Those are foundational. And then when you start to talk about, okay, what toxin is the most impactful, you can never say that, because every person gets their own unique blend of what's messing them up. But what you can say is, okay, how do you think about toxins? One is, think about toxins in 3 categories. You're either putting it directly in your body, that's the food you're eating, the water you're drinking, the alcohol you're drinking, or anything else you're drinking. That's where, if you're using single-use plastic water bottles, that becomes important. That's for a thing like, I never thought about kombucha. I don't drink kombucha. I don't like the flavor of it. But I had a patient who drank a lot of it. And one day she said to me, by the way, it comes in plastic bottles. Is that a problem? I'm like, yes, it's a problem. Didn't even occur to me to think about that, because I thought it came in glass. So avoiding drinking from plastic water bottles wherever possible, and substituting either glass or stainless or ceramic, depending on what the use is really important. That's what we're putting in our bodies. Then there's what we put on our bodies. And as women, we are putting hundreds of things on our bodies. Essentially, by the time we are ready for work, we've often put 250 different chemicals on our bodies, which is crazy. But those range from phthalates to plastics to sodium lauryl sulfate to other endocrine. I mean, the list is endless. And so the things we're putting on our body do make a huge impact. The dye we use to color our hair, the nail polish we use to do our nails, like all of those are impactful. And then there's the third category, which is what's around us. What are we putting our body on, and what's in our environment? So that's where gasoline fumes, like I stopped pumping my own gas when I got my toxins report back, because it was so high. And I was like, okay, we're going to eventually switch to an electric car, but in the meantime, someone else is going to pump it for me. So that's where it looks at flame retardants and the air quality, and whether you're getting exposed to VOCs or styrene or plastics, it's all around you. So when you start to think about it, you can never really know, like, I mean, I'm weird because I knew that thing that sent me over the edge, but that was just the straw that broke my back. I had a ton of issues. I just wasn't aware of it. Right. So it's hard to say, oh, that's the problem, because you have lots of other things in your personal soup, and it's all blended up. And every once in a while, you can identify a specific ingredient. And so if you can, cool, pull it off. But this is why we start to look at it as more of a holistic approach. Like, how do we start to clean up what you're putting on your body? How do we start to clean up your bed, your air quality, your water quality, the food you're eating? Start to systematically approach them. And you might not know what the thing is that made the difference, especially if you have autoimmune disease or chronic disease. It's sometimes really subtle to see what made that difference, but certainly bringing down the inflammation in the system by autoimmune paleo eating style so that your body's not so inflamed. It gives you a chance to see, how do you respond to things, what works, what doesn't work. So you need data and you need time and you need to systematically pull things off, because you can't say, oh, it's that for that. I will say the thyroid, because it's so close to the mouth and so many people have mercury fillings, that if someone has mercury fillings, you want to be really suspicious about thyroid health, because it all drains right past the thyroid. So that would be something to be suspicious of. And if you have osteoporosis, I would be suspicious of lead. If you have hearing loss, I would be suspicious of mercury. So there are some things where you can raise your suspicion. But when you say, oh, I have difficulty losing weight, I'm suspicious of all the toxins, because they're all implicated. That's the problem. But having said that, if you can get a handle on even 30% of your toxins and move them along, you'll start to notice that there's some line in the sand that once you come behind it and you stop crossing that line, your body will respond.
Yeah.
It's pretty cool.
Yeah, it is. It's so multifactorial. And like you said, from person to person, it's different. And figuring it out, especially with autoimmune issues, oh, that's just like a layer by layer, peeling back the onion. What else could it be? What else have I been exposed to? And just, just little by little starting to recover and heal. But I know, and I find myself sometimes getting to that point where you're just angry, like, why are we exposed to so much? Why is our food system so trashy? Like, why is this allowed? And, I think some of it is, it's just, come back to bite us, like, oh, we didn't know that was going to happen. But I feel like some things, like, we know that they're toxic, but yet they're still allowed. And that's just a whole nother conversation about why that is. But it's like, as a health professional, as a mother, especially, like, my kids are exposed to so many things that just make me so mad. And my kids right now, they're 19, 17, and 14. So my 19-year-old gets it. She's like, okay, I understand, A equals B, but those teenage boys, they like bucking the system right now.
Yep.
Like, mom, it's like when they're in my house, it's like you feel like you have control, but it's like they leave your house, they're driving on their own, and it's like, oh man, the exposure that you get just in, going to school and coming home every day is crazy. And we live like in a rural area where we probably, our air system is, or the air that I'm exposed to, we're kind of out and not in a big city. But even so, and we have our own well, but it's just, I have to take a step back sometimes. You're like, okay, it's here, it's what you're dealing with. And like you said, you just have to decrease your exposure as much as possible. And so my population, I know, this is probably a lot of what you have already said, and everybody is a little bit different. And, you really just have to look at your personal lifestyle and where your exposure might be coming from. But my population that I deal with in the podcast is mainly about insulin resistance and reversing metabolic illness, because it is reversible.
Yes.
I see it all the time. I see it every day with my students. They're reversing their disease. They're reversing their diabetes, type 2 diabetes, and fatty liver. And fatty liver is another interesting subject because of, you were saying how the toxicity in the liver can just build so quickly and be so pervasive. But with that specific population of metabolic illness, is there anything in particular that you would suggest or recommend that you haven't already touched on, where these folks can really benefit from certain things?
I mean, I think anyone who has metabolic syndrome, insulin resistance, pre-diabetes or type 2 diabetes, excuse me, is a perfect candidate for someone to work on toxins, because they are so inflammatory. And essentially you'll say to me, okay, well, why is this person getting insulin resistance and this person got cancer and this person got an autoimmune disease? Well, that's because of what your body is prone to expressing, right? I'm an autoimmune picture all the way, autoimmune and gut. If I get thrown off, those are messy. But I'm not an insulin resistant human. And hopefully I'm never going to be a cancer person, right? But I'm an autoimmune picture. You can have more. You can have more than, you could be more than one, right? You don't have to be in one bucket or the other, but typically people will sort of preferentially go down one pathway. And so that's, I mean, it's such a huge opportunity, Shanna, because obviously you're going to do the foundational work. You're going to make sure they're not eating food that doesn't like them back. They're going to minimize, I would say minimize or eliminate alcohol, minimize sugar, minimize anything processed, minimize the seed oils. That's like the foundational work. Make sure you're sleeping, moving, reducing your stress. That's all the basic work that you do, right? And then you go, okay, you've done all that and you still have an insulin of 13 or 20 or 25, and your fasting sugar is either normal or out of range. You're still someone who's got that picture. That's a toxin picture. So those are people who I would say, okay, really start focusing on the endocrine disrupting hormones. So that, I mean, that's it's massive. So level up your beauty products, eliminate plastic from your food storage, from your drinking, test your water. I mean, think about it. Perchlorate is in a lot of water. So you don't have perchlorate, but anyone with a municipal system gets perchlorate, and perchlorate is an endocrine disruptor, and endocrine means insulin resistance ultimately. And so if anything you can do to start peeling it off, reverse osmosis your water, test your water, get rid of the plastics, make sure you're able to detox properly by sweating and doing saunas and supporting the liver. It's like piecemeal, right? But absolutely, if you have any type of metabolic dysfunction, toxins are massive, really big.
Great. I'm glad we asked you about that, because we've talked about all those things on the podcast and all those foundational things. And but toxins are tricky, and it's not something that you think about. But I do have, some students who like heal 50% of the way or heal 75% of the way, and they're so much healthier than they were when they started, but they just can't seem to get to that point where like, I feel great, I have high energy. It's like there's still something that's missing, or something that's interfering. It's more of an interference issue with being completely healthy or near optimal health. So that's a great answer, and great thing to think about. So if we have an individual like that who's like, okay, I've done all the things, I don't know where to turn next, and maybe it is a toxicity, or likely is a toxicity issue. What would you suggest as far as like testing goes? Do you do the same type of testing on or if you even work with individuals, what's the testing look like? Or is that a person by person? We got to look at symptoms, we got to look at past history, we have to look at, diagnoses, that type of thing.
I mean, we always do that. Absolutely. But no, so in our clinic, we see men, and I only see women because I'm a gynecologist. And so I only see women, although I guess I could see men. I enjoy women. Like, I like treating them. And so, but in our clinic, we'll see everyone. And so here's where it's much easier to sort of have a protocol, because we're testing you. You can either do everything at once, which can be overwhelming, but will give you a really good sense of like, wow, I got a lot of work to do. Or you can, if you don't want to do everything at once, you can piecemeal it out. And then we're going to say, okay, based on what you're presenting with, we might head down this path more than the other. But typically what I'm saying to people is, we're going to test you for heavy metals, and you need to do this with a functional medicine provider. It's not, excuse me, it's not something you're going to do alone. Heavy metals, both baseline and provoked, mycotoxins, which we provoke because they're stored also, so we provoke it to come out, and then environmental toxicants and glyphosate. So there's 4 separate tests you could do. You can bundle them up and do 3 of them all together. It costs more, but you get a discount, but you spend more money intrinsically. So it just sort of depends what people are presenting with. I would say if it's really an endocrine picture, I would start with all of them, because all of them can equally throw off people's endocrine system.
Sure. And with glyphosate, is that something where, I mean, everybody's exposed to that. I mean, there's me having my own well, I still get exposed because of, I have crops around me within a couple of mile radius, but that are likely sprayed with that. But do you see certain manifestations from glyphosate, or is that just one of those things that it kind of triggers different things in different people? And maybe maybe listeners aren't real educated with what that is. I know we're just kind of like, they're throwing these terms around. There might be people who aren't really knowledgeable about what glyphosate even is and why to look out for it.
You said the magic word. I present on glyphosate. Actually, last year I presented at the Environmental Academy on glyphosate. So glyphosate's massive. It's the most commonly used herbicide in the world, and approximately every 7 years the use doubles. So it's unavoidable, especially, when you talk about living rurally. If you have crops around you, they're definitely spraying, and it gets into the groundwater. And so you can have it in your well because it's getting into the water table. Glyphosate is not directly harmful to humans, interestingly, right? Like, so why do we care if it doesn't harm us? Well, it harms our microbiome, which is the balance of bacteria in our gut. So it harms the microbiome, and it harms the good bacteria in our microbiome. And the bacteria in our microbiome can either help us lose weight, help us have proper serotonin and dopamine levels, or it can tank us and have us be anxious and overweight. So the gut bacteria actually play a role in our ability to lose weight. So glyphosate plays a role in there. It's also implicated in non-Hodgkin's lymphoma. So it does sort of impact us directly. And then the worst part of it is that, if we don't have bees and pollinators, we don't have food. And glyphosate is toxic to the pollinators and the soil. And then that impacts the birds because they eat the bugs in the soil, and the bugs are impacted. So there's a lot of ecosystems that are thrown off by this. It takes anywhere from 2 to 93 days for it to go away once you've sprayed it on something. So I'm not sure who could find 2. Typically, and there are some anecdotal reports that it takes even longer. So we care. So the reason we care is if your food is not organic, especially if it's a grain, when you process that food, you actually concentrate the glyphosate in your food. So if you're eating, I don't know, grape juice, and you're not drinking organic grape juice, the glyphosate and the sugar were both concentrated, and you've removed the fiber and a lot of the antioxidants, and now what you're left with is the sugar. So and the toxins. High fructose corn syrup is like that too. When you take corn and convert it into high fructose corn syrup, you have to use mercury to get it from corn to high fructose corn syrup. And guess what? The mercury goes into the food, along with, well, I can't really call it a food, into the substance, along with the glyphosate that was on the corn. Because remember, it's not an organic crop. You're concentrating all the glyphosate, and now you're getting bigger doses. And I don't drink juice. I actually never liked it, even as a little girl. I never liked it. So I never gave it to my kids, because by the time I got married, I married a guy who's like cuckoo about sugar, and then I became cuckoo about sugar. So we never gave our kids sugar in juice. But most kids are the ones who are drinking the majority of juice. So we're giving our kids a glyphosate load, and that's throwing off the system. So it indirectly impacts the endocrine system. So we do really want to focus on how do we clean up our food system so that we're not only not putting it ourselves, but not giving it to children who are still developing and are much more sensitive. You and I are less resilient. They're more sensitive because they're still developing. So it messes up children, but it also messes us up. Like, we can't just say, oh, it's only bad for children. No, it's bad for us too.
I never knew about the mercury with corn. Oh, that makes me so mad.
Horrifying, right? Fish
Oh,
fillings and high fructose corn syrup are the sources of mercury. I'm waiting. Actually, another source is that while forests sequester mercury, and when forests burn, either from global warming and natural events, or from people setting fires, that releases mercury back into the environment. And mercury is heavy, so it falls. So it gets onto the ground, and then that makes its way into the water table and its way into the ocean, which makes its way into the fish. And so I'm waiting, because of all the wildfires last year, I'm waiting to see if there's any studies done on the levels of mercury in California foods, as well as California seafood, because it winds up in us indirectly.
Yeah, in the oceans and everything that's eating in the oceans. Oh, I know it is. And this is why it like just starts to make you crazy after a while. But yeah, I never knew about that connection. And I'm like you, like I just don't have juice in our house, and our kids know, like we just don't have it. And there were a lot of questions like, we're the only household we're the only kids who don't have juice. We're the only kids who don't have cereal. I'm like, well, that's just how
Sorry. I'll pay for your therapy.
Yeah, sorry. Exactly. So let's talk about your book and then we'll close out. How is your book? Like, give us the premise of your book, Dirty Girl, and how is it laid out? And yeah, let's just talk about your book. What's that
So
about?
it's Dirty Girl, Ditch the Toxins, Look Great, and Feel Freaking Amazing. And it's really meant to be a roadmap for normal humans to walk their way from total lack of knowledge. If you have total lack of knowledge, or if you have tons of knowledge, either way, it's meant to walk you through, how do you start to level up? How do you start to eliminate the toxins that are around you, getting on you, getting in you? And how do you start to peel away these things that we think of as inevitable? Like, most people think of diabetes as like, well, I'm just going to get that. And I'm like, and you and I are like, no, you're not meant to get that. You're meant to be vital, vibrant, fully healthy, able and interested in intimacy till you're at least 100, and that every decade gets better than the one before. We reject the common idea that you're meant to just start failing. No, you're meant to be freaking amazing. So the book starts to walk you through all the things you can do on your own. And if you get stuck, that's where I come in, right? I do functional medicine, and we actually have a brick and mortar practice, but you can do a lot of things on your own. And it's really meant to give you the tools so that you can start to wade through, like, what do I need to do? What's impacting me? How do I peel it off? Because otherwise it's analysis paralysis. It's like, I don't know where to start. So the book walks you through, like, where do you start? What are the top tips? What are the top things you should focus on? So we have that.
Awesome. Yeah. And that's with nutrition too. People are, I just don't know where to start. It's so,
Right.
there's so much information. And then you just, yeah, like you said, it's just like you're paralyzed. I'm just going to keep doing what I'm doing because I don't know where to start. I know. So I'm always like, let's just start with eating meals and not snacking. Like, let's make it that simple. And then just step by step start to implement some new things from,
Yes.
day to day, week to week, just a little bit at a time. So that sounds like a wonderful book. And something that would be, and because people just don't think about toxins a lot. And like you said, it's just kind of that last ditch step. People think, okay, I have everything in place. All my foundations are there. And it can be overwhelming because you just don't know, and you don't know about it. And yeah, definitely work with a functional practitioner. We've been there, I mean, with my son, and asking for these out of the box tests. You will get looked at like a deer in the headlights if you were to go. I mean, at least for me, if I were to go and ask my son's doctor, his pediatric doctor we were working at when he was very ill, about heavy metal toxicity and can we test him? I mean, why? Why would we look at that? And
you just don't get that training either.
Like, no,
Shanna, they don't get the training. It's like,
exactly,
you don't have the tools. It's like asking your nail salon person to build you a house, right? Like, you would never do that. You wouldn't be like, come over and build me a house. You'd be like, come over and do my nails. So it's just asking the wrong person to do the task. Because I never had those tools when I was in sort of mainstream traditional practice. I was never trained.
Right. And that's, as we progress with the disease process, instead of getting mad that they didn't know or how to answer my questions, I just, you just have to say, okay, that's not how they're trained. So if they're not trained in this, You can't
Yep.
expect them to answer it. So you work with, do you just do brick or mortar, or do you do virtual clients also?
No, so we do virtual clients. It's so funny. We were just diving into the laws in Massachusetts because they're like really strict. So technically, if you can establish care remotely, but you have to be in Massachusetts, which to me makes no sense because if you're remote, what difference does it make where you are, right? But technically, I should not be practicing medicine in another state unless you were an established patient. So people generally have to come on site to establish care if they're not Massachusetts residents, and then their follow-up they can do remote. We're an insurance-based practice, and we're a membership-based insurance practice. So we do absolutely that. And then we also have the wing where our Dirty Girl Detox line, where we do community programs. We have that Feel Freaking Amazing, excuse me, 8-week program. We have supplements. We have the book. Like we have the stuff you can do without the doctors. So you can really do what you can on your own. And then when you get stuck, that's when we come in.
Okay. And where
Yeah.
can we find you to learn more?
Everywhere. So all of the social are at Wendie Trubow, MD. We have a podcast called the 5 Journeys Feel Freaking Amazing podcast, and that's on all the things. And then we have our clinic, which is 5 Journeys, and the detox site, which is called Dirty Girl Detox.
Awesome. We'll link all of that in the show notes. And thanks so
Thank
much
you.
for educating us today. And I think you gave a lot of people hope where they
Yeah.
just are feeling stuck. They don't know what the next move is. And I'm sure your book is a really great first stepping stone for people to access and read. So thanks for coming on the show today.
My pleasure. Thanks for having me on.